and welcome to Tuesdays with Tina. It's Tuesday, April 2nd of 2024, and today we are going to talk about POTS, P-O-T-S, which is Postural Orthostatic Tachycardia Syndrome. So that's our topic today. So as people come in, we will get things going. Hello, Facebook friends down here. How are you doing? Hello, Instagram fam up there. And as I said today, we're going to be talking about P.O.T.S, POTS, Postural Orthostatic Tachycardia Syndrome. Now, this comes from a question that I received on Friday when I was doing a medical emergencies webinar for today's RDH. Somebody asked me a question regarding this particular syndrome. So I thought I would share the question and answer it with you all here. Now, before I dive into that, I do want to let you know, for some reason, if you missed last week was all on infection control and local anesthesia. It was a great review with Michelle Strange and Amanda Hill. We recorded it and it is on the Teacher Tina RDH YouTube channel. So if you missed that one, go to Teacher Tina RDH on YouTube and you can watch that there. And this particular session will be uploaded to the Teacher Tina RDH as well. So feel free to join me there and, share it with your friends. Okay, so as I said earlier, last Friday, I did a webinar for today's RDH all on medical emergencies. I love the topic. I love sharing that information. And during the Q&A section, someone asked a question about POTS, P-O-T-S. And I'm going to say it again. It's Postural Orthostatic Tachycardia Syndrome. And what an individual who has that syndrome, what their ASA status is. So before I answer that question, I figured for those of you who join me live here, I would share with you a little bit about what that is. I'll answer the question of the ASA status, and then also how does it relate to us in dentistry? What do we need to do to adjust with our appointments, our anesthesia, and all that kind of such. Now, I will say I'm in the early phases of doing a lot of research into this. It is a fairly I don't want to say rare, but it's not a very commonly diagnosed syndrome. About 1 in 3 Americans will have, or not 1 in 3, 1 in 3 million Americans will have it. If I'm recalling the statistic correctly, mostly it's going to be women that will feel it. Now, we break it down: postural orthostatic hypertension, tachycardia. So basically it is a changing of positions, causes lightheadedness, can cause heart palpitations to really increase, and can cause someone to pass out. So that's what it will end up happening. Now, how does this relate to, or what are some of the signs and symptoms with it? I will tell you. It relates to dentistry in regards to what kind of anesthetic we can give, all right, with vasoconstrictors and medications. But it's just so that you know what some of the signs and symptoms are, and I'm going to read it off because I wrote it down so I didn't forget. Okay, so some of the signs and symptoms of it really kind of go along with, I was like, wow, sounds like menopause, because it's brain fog, fatigue, lightheadedness, heart palpitations. There's a lot of those kinds of things. I'm like, well, yeah, I'm of that age, and that's, me and my friends that are of that age, that's what we experience, is that brain fog and lightheadedness. Oftentimes fainting, heart palpitations. There's also things like exercise intolerance, like the inability to sustain long-term exercise because of heart rate can make it more challenging for them, for someone that's been diagnosed with this syndrome. Now, oftentimes treating this particular syndrome is a couple of different ways. It can be to increase the patient's blood volume, so giving them lots of fluids, oftentimes increasing their sodium, medications that increase the sodium levels in their blood, and beta blockers. Beta blockers. So when a patient has this particular syndrome, they could be taking a lot of medication. So if a patient is taking beta blockers, and you ask them why, and they say, oh, they have POTS, then oh, this is somebody with a postural tachycardia that could pass out, have heart palpitations on me. Now with that, because they have tachycardia along with it, that makes them very, very sensitive to the epinephrine. So if you're using an anesthetic that has epinephrine in it, you have to be cautious with this. Okay, so you want to make sure you're using a very diluted amount of epinephrine if you need to, so like a 1 to 200,000 epi. Now, levonorepinephrine is not used often here in the States. It's hard to find the solution, but if you are somewhere in a country where you do have levonorepinephrine as an option, you could use levonorepinephrine because it is not as strong. It's about a quarter of the strength as epinephrine, so that could be an option for you. So one of the there's a couple of categories that POTS falls into, and one of the ones that I thought was really interesting is there's one called adrenergic postural orthostatic tachycardia syndrome, and the adrenergic means that it is due to elevated stress hormones like norepinephrine. And I started thinking, I was like, oh my gosh, like how many people, especially hygienists, maybe dental hygiene students out there might have increased stress in their lives and might have something like this to go as a syndrome that they're dealing with, or maybe as a transient thing. So just thought I'd throw that out there for those of you who have high stress lives. You know, maybe work on some stress management, maybe. I don't know. Thought I'd throw that out there. So those are some things. So remember, if somebody has been diagnosed with POTS, you want to pay attention to your vasoconstrictors. Use a plain anesthetic if you can. The other thing is patient positioning. When you tilt them back, don't let them like rush back up. If you can try to keep your appointments short, that's awesome. Or give them breaks where they can come sit back up. When they are sitting up, give them time. You know, make sure you leave time at the end of the appointment. Or if you need to set up another room for your next patient, but allow them to have that time to get the blood flowing back to all the parts of the body that it needs to go. Okay. The other thing that I found very interesting when I was researching this is that oftentimes there can be a subset of people with this particular syndrome, this orthostatic postural tachycardial syndrome, that also have the connective tissue disorder called Ehlers-Danlos syndrome, which is interesting because individuals with Ehlers-Danlos will also have struggles achieving anesthesia. Like it's harder for them to get numb. So we use vasoconstrictor to help with getting them numb. We use an increased vasoconstrictor. So we kind of find ourselves in a catch-22 situation when we have those individuals. So I think that's very interesting. I'm going to be diving into that research a little bit more to understand that, but something to be aware of. And I will have to say I am learning more and more about Ehlers-Danlos syndrome as well. So I think it's pretty interesting. So in that regards, just thought I'd share that with you. Somebody with POTS, P.O.T.S, postural orthostatic tachycardia syndrome. I'm going to get that down. Probably be an ASA2 or an ASA3 status. Now, there's a big difference between ASA2 and ASA3. Really, honestly, it depends upon what some of their other comorbidities are. If they have any other issues going on, what kinds of medications, what their blood pressure is, how their heart rate. You're going to see somebody with could potentially have a high heart rate on there. So these are some of the things that to be thinking of. Oh, wonderful. I'm so glad that you're enjoying this information. Amazing smiles, hygiene. I appreciate it. Yeah, I loved getting that question from that webinar that I did with today's RDH. Great virtual class on medical emergencies and sharing that. And I appreciate the questions because when people ask questions and if I'm not 100% aware of what the research says, it gives me an opportunity to dive into it. So I got to learn some new things about it as well. So I hope that you've found this helpful and informative. And somebody just says, I find Septicane works really well for my patients with Ehlers-Danlos, but if they have POTS that may have mast cell too. Okay. Great. Thank you, Amanda. Yes. And of course, I love Septo. And then a great thing about Septo is it does come in a 1 to 200,000 epinephrine, which is wonderful for both of those patients. Thank you, friends. I love this. Wonderful. Ehlers-Danlos and Septicane. Septicane. I'm a fan. I love it. I wish everybody used it more. All right, friends. With that being said, I didn't have a quote this week to share with you. So just go out there, continue to do great things. Today it was nearly mid 70s in my hometown in Oregon. And before we have some rain come in, so I got to go and play out in the sunshine a little bit too. So it was wonderful. Please, friends, share this with your friends. Go to the Teacher Tina RDH on YouTube. I'm trying to get more of these videos on there and get that area uploaded because it's kind of nice to be able to have a place to make it easy to go back and refer to some of these. And I've received some questions. Someone for future Tuesdays with Tina Talks, somebody asked if I would discuss injections with someone who has lip implants or has had a lot of work done along their oral structures and what it's like, the sensations. So I think that might be a topic coming up. Tell me, or if you're interested, send me a message. And if there's something else that you are like, ooh, I would like to hear a little more about this, please let me know, all right? Okay, friends, until next week, thanks for being here. I really appreciate it. Cheers. Bye.